TMJ is short for temporomandibular joint. So really it's a temporomandibular joint disorder, but everybody calls it TMJ or TMD. The main issues that are taking place are usually something with the jaw joint itself, so where the skull bone and the jawbone meet up. There's also a disc of tissue that acts as a cushion. Sometimes that will just get dislocated in different places, and there's some different areas that, depending on how it's getting compressed or kind of manipulated, it can cause some pain. So we look at that. And then also a lot of the muscles of mastication. So the temporalis, the masseter, a lot of times those will flare up. That may not be the cause of the problem, but sometimes your body will almost like guard, almost like if someone was to throw a softball at you and you kind of brace for impact, those muscles will do the same thing where they kind of tense up and try to protect the region. So when you're looking at everything that's taking place in there, you're looking at not just how the bones interact and the disc, but also the muscles and the ligaments. There's a whole capsule of tissue that kind of acts in this area. So really teasing out what's taking place and breaking it down by piece is the best way to treat it. Depending on what's going on with your TMJ, that really determines what we're going to do to treat it. Typically there's some sort of oral appliance, a splint, that's going to help hold the jaw in the right place or kind of deprogram or help those muscles calm down a little bit. A lot of times too, we'll talk about Botox for the muscles. A lot of people are worried that it's going to kind of do this kind of thing, but we're not treating those facial muscles, we're treating the muscles of mastication. And I tell people it's not like we're turning a light switch on and off. Think of it more like a dimmer switch. We're turning down how strong those muscles clench and squeeze. So we're turning down how strongly that's taking place, and it really helps with that discomfort.